whole. So right at the start of this conversation, I wonder if you could outline what are the key benefits of fasting that you have seen in your patients?
Traumatic. I've been a cardiologist for 30 years and I've tried everything. But when I tried fasting, I started seeing changes. People began to lose weight. People's blood pressures came down. Diabetes got reversed. The progression of coronary artery disease went down. See, I had the benefit of seeing patients from day one. So I saw that they were having a second angioplasty, another heart attack in 2 years, 5 years. I saw the numbers going down on those whom I was able to get them to lose weight through a fasting program. And I tried lots of diet programs. They didn't seem to work, but fasting did. So decreased blood pressure, decreased diabetes, rehospitalization, LV function seemed to stay good, which means that heart muscle function continued to do well. Patients mentally also seem to be doing better. So fasting gave me not just this benefit, but a lot more. Also, my patients didn't end up in the hospital with fractures or falls, and they had stronger muscles, and mentally they were better. So I started seeing that just generally patients were doing better. ER doctors telling me, how come your patients don't end up in the ER with acute heart attacks? All these benefits I saw with fasting.
With all these, quite different benefits that you just outlined for us, why is it, do you think, that very few medical doctors are promoting fasting with their patients? Of course, as you demonstrated, it has huge benefits. It's very effective. It's also kind of free of charge. So why is there such a resistance among, like our profession, to recommend this as a treatment?
It's a tough sell, and it takes time. You see, you're only as good as getting into your patient's brain. Can you get in there and make them make those changes? And that's a tough one. Because all you're doing is you're giving them the advice. There's no tools for me to give them. There's no tablets to give to them. They got to make that effort. And all I got to do is get into their brain, change the way they think. And if they get convinced that, yes, doc is telling me something that resonates inside me, and I'm gonna make that change, then they'll do it. So the trouble is that most of us doctors are too busy. We're actually taking care of disease processes rather than prevention. Here, we're really talking about a lifestyle change. And that's the hard part about fasting and talking to someone about fasting. Physicians find it very difficult to talk to them about that because you can just tell them that, okay, these are the benefits. That's not good enough. It takes much more than that. It's a deeper dive into the patient's lifestyle. How do you wake up in the morning? How do you feel in the morning? What are the main issues in your life? So it's not just about fasting. It's about your relationships. Who are you? What's your life all about? All that affects your diet. Because see, fasting is also about, it's much more, it's about your whole life. It's about who do you think you are? And can you empower yourself to do it? Or are you just a slave to your day-to-day routines and advertising? So to get somebody to fast, you really need to change their whole outlook on who they are. You are not your habits. You are not even your body. You are something that can change everything. There's a separate part of you besides your body, even your mind. There's a separateness, there's an awareness inside you. And if I can get into that awareness, then I can empower you. And if I can empower you, then I can make you fast. So doing this whole thing, it's not easy for most physicians, and even people who are dedicated to teaching people about diet. It's a hard sell. And I think that our approach has to change. Our approach, I first look at patients and I have to empower them to say, you are more than what you think you are. You can do it.
Your videos on YouTube have been going viral for a number of years now, and I've read a lot of the comments and I've watched a lot of those videos, and I think one of the many things people deeply resonate with you and your message about is this real passion to help people and this real passion to empower people. And I want to sort of dive in there a little bit, because you are, a very well-respected cardiologist. You literally go into people's hearts, you put in stents, you do all this kind of stuff. In some ways, as life-saving as putting a stent in someone's heart potentially can be, it's slightly disempowering, isn't it? It's kind of like, well, I've got to rely on the skill and ability of my doctor to be good at what he does, to be sharp on the day, to have slept properly the night before, right? All these things are out of my control as a patient. Whereas pretty much everything you're talking about, and we're going to go through in detail today, is about putting the patient back in control of their health, and I guess I would argue their wider happiness as well.
Watch it, lady.